And we're live.
Well, welcome everybody. I wish we were talking about something other than COVID, but COVID it is. And while it's everybody's responsibility here to fight the COVID pandemic, the three people in the county who are most directly involved with this are our county administrator, Jason Molino, our county public health director, Frank Krupa, and our deputy county administrator and director of our emergency operations center, Amy Hendricks. So while we're seeing an increase in cases, as is the case everywhere else, it's important to recognize how cautious and vigilant our Tompkins County residents have been throughout this pandemic. Wearing masks, reducing density, managing and adapting during lockdown have all helped to keep the number of cases we've had relatively low and keeping each other safe. It's critical that we continue to do these things moving forward as we see this recent increase. The southern tier has been seeing significant increases in cases, and we're starting to see what the governor has defined as microcluster zones in southern tier counties. As these zones are defined, our health department and emergency operations center are keeping close watch and preparing for if we have one of these zones in Tompkins County. Thank you to community members who've been submitting questions for this COVID-19 update. We'll start by getting a general update from Frank Krupa, and please feel free to share any additional questions that you may have, and we'll try to answer them tonight. So Frank, can you give us your assessment of the increase in Tompkins County and what the contributing factors have been to this increase and what we should be doing as a community to stop them?
Thanks, Deborah. Yeah, obviously we're watching what's going on around us very closely. Our sister counties are experiencing significant upticks all throughout the southern tier. And we've seen an uptick in cases, not to the same levels as they may be, but obviously higher than we're used to. And so we have to continue to remain vigilant. I think what we continue to see is small gatherings with people being together for extended periods of time still are the #1 transmission mechanism that we have. And I think the reason we're seeing cases go up is, certainly in our county, is because it's reflective of the region. We have a lot of people that come from counties around us to work here in Tompkins County or to recreate. And we have people in Tompkins County that work in the surrounding counties as well. And so unfortunately, COVID does not recognize borders. And we commute in between, and so it's expected that we would see some increase. I think the good news is, to date, we're still not seeing the dramatic increases that the other counties are, and I think we can attribute that to how responsive our county continues to be in following the guidance. And you ask, what should we be doing? It's those same things that everyone's tired of hearing me say: wear your mask, stay 6 feet apart, keep low densities, and wash your hands often and well. Those 4 things are still the best public health interventions that we have for COVID-19. If our community continues to remain vigilant, hopefully we'll see our numbers level off and then begin to reduce.
Thank you. Jason and Amy, what are county officials going to be doing differently, if anything, to try to quell this latest uptick in cases?
Well, I think both you, Deborah, and Frank kind of touched on exactly what we need to continue to do. It's what we've done in the past, ensuring that people are wearing their face coverings, the density is minimized, people are staying vigilant. I know we continue to and will continue to remind people with kindness and education, should they be perhaps in violation of those requirements with face coverings or gatherings. But frankly, we've had a great compliance record with our community, our business community, our public, our higher ed community, our students, and faculty alone. So I think it's continuing what we're doing. And we will react as we have to any changes that come from the state or that come at us from different angles, whether it's adapting and getting ready for vaccination distribution, or whether it's if we do happen to get a cluster in our community, how we react to it. So we'll stay flexible and nimble with it, but I think the overarching message is to continue to do what you're doing because it seems to be working, and that's face coverings, no gatherings, low density, washing your hands, and don't go to work if you're not feeling well. Amy?
Thank you.
I think you hit it, Jason. Continuing on, I think the different pieces is people are tired, and we get that. And so it's that endurance piece that we have to continue to support each other and push through. So continuing to do those 4 things, continuing to really embrace it and understand that that's what's helped us get to this point. And we have been doing well. So we just need to continue on.
Thanks, Amy. Frank, how is the county working with the school districts, and what factors are schools looking at to determine when they need to shift to remote learning?
We've been working with local school districts all the way back in early March, prior to the decision to close schools, and through the summer, through their planning for reopening, and now helping them navigate that reopening, including as cases begin to emerge. The question about, how is decision-making occurring about closing or going fully remote? I got to stop saying closing because they don't close. Our schools are still operational, whether the kids are there or learning virtually. But what goes into the decision-making often, because we haven't yet found transmission within a school, is that it's more based off of the school's ability, one, to give us time to do our contact tracing. It takes at least a day or so. So if it happens in the middle of the week, sometimes they make the decision to go to remote for a day or so to allow that contact tracing to be completed, so we don't potentially unnecessarily expose anyone additionally. But I think more often it's around the amount of adults that end up quarantined connected to a case. You need to have the adult supervision to run the schools and teach the kids. And it takes some time to kind of figure that out. Even in the best of times, if you lose a handful of teachers on any given day, it's a scramble to make sure you have enough folks there to operate the school. With COVID, they're already tight on the number of adults they have. And so it takes a little bit of planning to get that in place. So in most instances, it's about allowing the contact tracing to get finished, and then for the district to work out how they're going to have enough staff to be able to run the schools safely and have enough adults for supervision and teaching.
So would it help if we started closing indoor dining and other indoor facilities so that we would be protecting people and prioritizing keeping our schools in in-person learning status?
I think we are prioritizing our schools. We all want our kids to be back in person as much as they can be. There are guidance in place that puts restrictions on restaurants in a way that hopefully allows them to operate, but do it safely and limit spread. Really what we need folks to do in order to prioritize our children being in school is to follow the guidance, right? So if you do go to a restaurant, wear your mask until you're seated and eating. Make sure that you're not going into a crowded restaurant. If you pull up and they don't appear to be following the guidance, don't add to the problem, right? Make those personal choices. So I think we have to prioritize our entire community in order to do this successfully. And it takes all of us acting responsibly, taking personal responsibility, and following the guidance that we've been providing.
Jason, would the state need to make a determination that schools are a priority, or is that something we can do locally?
At this stage of the game, I think the state would make that determination. Earlier at the beginning of this pandemic, we worked collaboratively with the school districts before the state took the initiative to shut the schools down. I think at this stage of the game, the governor and the state seems to be tuned in, and if there is a concern in the specific district or regional area or hotspot in this case, they would be making the decision. And from that perspective, any emergency order or declaration that we make locally has to be approved by the New York State Department of Health. So in this case, I don't think it's anything that we would make locally. We could always encourage folks, and like Frank said, he's in contact and the EOC's in contact daily with school districts, TSD, BOCES, helping them work through whatever challenges and questions they may have.
Thank you. Frank, you mentioned we've got a lot of in-commuters and a lot of people who work outside the county. So in cases where you're commuting to or commuting from a county with a much higher incidence of cases than Tompkins, are there any special precautions that you should be taking?
I don't know if they're special, but you certainly need to be paying closer attention, and we keep using the word be vigilant. It's really important, right? If you're going to a higher incidence area, you need to take those steps very seriously, the mask wearing, the social distancing and such. You know, if you're coming to our community and you have the ability to do some shopping here versus going to a grocery store in a high incidence area, you know, those are always things to consider, but it's really about just judging for yourself about where you are and who you're being exposed to, and trying to limit those exposure points by following the guidance and just being mindful of what's going on in your community.
Thanks. Yes, I mean, we've been noticing that Elmira has a big spike. The rates are high in Cortland and Broome County. Is there a higher risk of community spread from those communities?
So we definitely are experiencing community spread. We report this every Friday on our website, whether or not we're able to determine if a case is connected to another case, which if we can't, that's when we generally define as community spread. And we are very interconnected. I said before, the disease doesn't know boundaries. And so as people move about, if there are cases rising around us, then that creates a higher exposure potential for us here in Tompkins County. Doesn't necessarily mean they're doing anything wrong. It just means that they have higher incidence right now, and we need to be mindful of that. And as folks come in, we'd ask them to be very careful and follow the guidance. And you know, if you work with or know folks that come from, please support them in that. Right? They may want to do things a little bit differently because they know they could potentially expose people because they've been around. They've been in a community that has more incidents. So we just want to be respectful of each other, follow the guidance, and you know, as folks are commuting in and out, to just make sure that they're taking extra precaution.
Would it be helpful if employers encouraged their employees to work from home, if at all possible?
Yeah, I think telework is something we've been experiencing throughout this. And, I think for any business, if they can evaluate whether or not somebody needs to come to work or not, that's just one less potential exposure that could be in place. But understanding that some businesses, some activities, they have to be in person.
Yeah.
No way around that. So I think for every organization and business, they have to do an evaluation of what works for them and for their business. And if they can have folks telework and that makes sense, certainly it would limit potential exposures.
So Jason, what's the county's position on telework? Are we encouraging some departments to work remotely?
So a lot of departments have employees that have continued to remain on remote work status since March. And we're actually in the process right now, Deborah, of kind of doing an overhaul evaluation of what's happened over the past several months and what it may look like in the upcoming months. So our planning section out of the EOC is starting to look at different departments. So who's working remotely? What's the percentage of that? Is it successful? Can it continue? If so, it can continue under what conditions should it continue under? Kind of doing a review of it. It's been over 6 months now that we've had remote work in a non-traditional sense. Generally, remote work isn't used in this context, but we're trying to evaluate several things. One, is it working successfully, and if so, how can we continue to build upon that? And if it isn't, how can we make it better? And two, trying to understand how long we can stay in this approach. Is it indefinite? Is it still for another 6 months, another year? I think we're trying to evaluate all that, and hopefully in the next 30 to 60 days we'll have a better understanding. But right now we have probably, I want to say between probably 60 to 80% of the workforce is in person, and could be on some form or fashion working remote on a rotating schedule. So we still have a lot of folks that are still in person. And again, just as well as anybody, there are certain positions like correction officers, deputy sheriffs that cannot work remotely for a variety of reasons. So they'll always remain in person. But it's something that we're evaluating. A lot of our colleagues in other counties are going through the same challenges and questions. What do we do? How long do we do it for? Is it successful? And we've had some great success stories with it. It's opened up new opportunities that I don't think we would have been able to figure out as quickly as we did. And there are certain circumstances where we've had to make changes on the fly because either your customer or consumer or client demands it requires to be in person or approach it differently. So it's something that we're going to evaluate in the upcoming next weeks and months as to how we've done over the past 9 months.
Thank you. I'd like to shift gears a little bit now. Frank, I've been hearing from constituents that they're a little bit confused about the contract tracing. Is every positive case a trigger for contact tracing? Contact tracing. Say that.
Yeah, I know, right? Yes, every person that tests positive for COVID is a case investigation is performed on, and from there we identify contacts, and those contacts are traced. What I would say is that first, the case belongs to the county of residence. So if somebody could get tested at our mall testing site, but say they live in Cortland County, those results go to Cortland County and they begin the case investigation because the person resides there. If they discover there are contacts in Tompkins County, those contacts are transferred over to us for us to follow up on. But we do a case investigation on every positive case that comes through.
Thank you. Can you briefly walk us through what an investigation looks like?
Sure. I'm not known for being brief, but I'll try. So we get a positive case reported to us. So somebody goes to a testing site. Anyone that does a COVID test is required by public health law to report that to the county of residence. Generally, that's done through a state data system. So once the positive test result comes in, it goes into that system. Our nurses check that system regularly to see about new cases. Once they find and pull off that case, it starts with a call to the individual that tested positive. The first thing that we're checking on is, are they okay? Do they have health? Are they having symptoms? Or do they need to go to the hospital? How are they doing? That's our first concern. Then we work with them on isolation. We want to make sure that they can isolate, meaning having their own bedroom and own bathroom for the next 10 days or so while they're in isolation. And then we interview them. And we find out where they've been during their infectious period. And so how we define infectious period is 2 days prior to the onset of symptoms, or 2 days prior from the testing date of someone that tests positive that was asymptomatic or without symptoms. So once we find out when the infectious period is, we start with that person. Okay, when you woke up in the morning on that first day, we're going to walk through everything you did between then and now. And we identify everywhere they've been and anyone that might have been a close contact. We define a close contact by anyone that has been within 6 feet for more than 10 minutes. That's the starting point. There are situations where you may have been 6 feet away and worn a mask, but we're in a room with someone for 2 hours. We would call that person still a close contact because of the length of exposure. So once we identify all of those folks as close contacts, then we move on to calling them. And we move to put them into quarantine. And that process usually takes us about a day's time, depending on how many cases there are. If it's 2 or 3, we get that done the same day we get the result. If some case, we've had upwards of 100 contacts to a case, that takes us a day or so to kind of work through all of those. Those individuals are placed in quarantine. Quarantine is for 14 days. We get this question a lot. It is 14 days no matter what. You can't test out of it. A positive test only tells you in that moment if you were positive. Quarantine is about the incubation period being 2 to 14 days. So we want to make sure that we don't let you out of quarantine until the disease has time to fully incubate and that you haven't developed symptoms. What some people might experience is they might get a call from us and being placed in quarantine, and it might only be for 7 days right, that they have quarantine. The quarantine period didn't change. It's still 14 days. But say somebody got tested on a Thursday, we got their results on Friday, they were symptomatic on that Thursday, and we go back 2 days and you were exposed 2 days prior. All those days count towards your quarantine. Your quarantine starts the last day you were exposed. So we may be calling you on Saturday, but the last time you were exposed to them was Thursday. And so 3 days have already come off your quarantine. So the quarantine period is always 14 days, but when you get a call from us, you may be in quarantine for a shorter period based off of when you were last exposed.
Oh, yeah, I can see why people are confused, can't you? So how do you determine if somebody has recovered? Do they have to get 2 negative tests, or what's the story?
No, there's no testing required for recovery. So generally, what we know about the disease is that from your onset of symptoms, it takes 8 or 9 days before you're no longer contagious. So our isolation period, so when a sick person or a positive case is placed in isolation, it's for 10 days to kind of go 1 day beyond that, infectious period. There's no need to test. Many people will test positive for weeks and months after having recovered. We discovered that early on because we did originally use 2 negative tests to release people, and we had folks in isolation for upwards of 90 days in some instances because they just continually to test positive. Because you test positive doesn't mean you have the disease in a form that you can be infectious to other people. So we know that it's that 8 or 9 days, so we use 10 days. There are some situations where it might be more than 10, going to your point about clarity. If somebody is still experiencing symptoms in day 8 or 9 and hasn't really recovered, we may extend their isolation period. Or if they have an underlying health condition that might not allow them to fight the disease as well as others, we might extend that to make sure that their body has enough time to get to a point where they're no longer infectious. All of those decisions are made in consultation with our medical director, Dr. Klaypak, and it's done on a case-by-case basis.
Thank you. So now for some timely questions. With the increase in cases, how are we suggesting that kids deal with Halloween?
The $1 million question. Yeah, so trick-or-treating is a risky activity. We put out some guidance where we've recommended ways that folks could still do it. Really, it's about setting up a table or something out front of your home with individually wrapped candy. We don't want people reaching into a bowl over and over again, right? So it's about, lining them up on a table, you staying at least 6 feet away or inside, and the kids come by and just grab candy off. I get that that's not what we traditionally think of as trick-or-treating, but we knew people wanted something. And so we tried to provide guidance that would allow them, to have a Halloween, but do it safely. What we want to encourage people not to do is to gather for parties or large indoor events. There's still the under 50 kind of non-essential gathering for any events. That's why trunk or treats really are not recommended because they can have high volumes of people coming through. So it's really, again, about keeping density down, keeping separation. Try having Halloween as a family, right? The group that you've been around, that you've been living with, do candy hides in the house. If you have a backyard, do something out in your backyard with your family. Stay in, play games, watch scary movies or Disney cartoons, whatever works for you and your family. But we want to celebrate Halloween. We just don't want large numbers of people getting together or having a lot of close contact.
So you mentioned there was guidance. I assume there's something in writing. Where can people go to find that if they need it?
All of that is on our Tompkins County Health Department website. So folks can go there and there's lots of guidance. There's actually a sign that our PIO group put together that's kind of cute as a mask on a jack-o'-lantern that lets people know that trick-or-treating is happening at your house and that you'll have things set up in a safe way. So we tried to provide some guidance on our website for folks.
That's great. Thank you. And what about voting? I mean, we saw long lines this weekend, and that's great. Is there any additional advice you would give people, or is it just the standard stay 6 feet apart, wear a mask?
Yeah, it's still the same things. I know our Board of Elections has been working to try to create a safe voting environment. I know I drove by the early voting site this morning at the Crash Fire Rescue Building. People were outside in the rain, and to a person, they were at least 6 feet apart, right? So I think folks get it. It's just important, you know, when you do go to your polling place to be mindful of those separations. Please wear your mask. Wash your hands on the way in, wash your hands on the way out, and follow all the rules and guidance that Board of Elections has set up in the locations.
And what about Thanksgiving, guys? I mean, and Christmas even. People are going to want to get together with their family. They may have to travel to do that. Do you have any advice for us, or are we just going to celebrate the holidays on Zoom?
I can share with you, you know, we have my extended family. We usually have 20 plus that get together for Thanksgiving. You know, my wife's side of the family has 13 grandchildren. We have 4 of them, and there's a lot of family members. It's a great time. Unfortunately, we can't get together this year. You know, we're not going to be driving to Western New York to meet up with everyone, particularly my mother-in-law and some of the elders in the family. So. You know, that's what we're doing just as a family of locally, and you know, we would generally go to Western New York to do that. For Halloween also, we're not going to go out trick-or-treating. We are going to hide a bunch of candy, which inevitably means if we don't count it, we will miss something that will be laying around in the house somewhere. But nonetheless, you know, that's what we're doing just from a personal perspective. And I think, you know, we talked a little bit about this maybe at the town hall, Frank, that we had with our own staff this Friday, and that was, you know, you might want to think twice about getting together with grandma and grandpa. But yeah, I think that's where we're at right now. Frank, I don't know, or Amy.
Yeah, you know, I'll just share this, Deborah. It's not uncommon for us when we find a case to have the entire household result positive. Right, that happens fairly frequently because the most common point of spread is in those household contacts. And Thanksgiving is exactly what we don't want. You know, groups of people gathering together, sitting around a table for extended periods of time while they're eating, not wearing a mask. All it takes is one person, and particularly Thanksgiving brings generations together, right? And so grandma and grandpa, elderly parents might be there that are at higher risk, and we need to really think long and hard about whether, you know, you mentioned Zoom Thanksgivings. When it comes to protecting my mother and my parents, we're not going to be getting together because of that, you know, because we just don't know, and the risk to them is too much.
As a grandma who hasn't seen her grandbabies for over a year, I am not enjoying this, but I understand, and I wouldn't want to take anything to them either. So let's talk about testing. I know that Tompkins County seems to be doing a lot more testing than its neighboring counties. Do you think that there might be a less invasive kind of test that would be coming up that would be helpful with school-age kids?
They're working on it. They're definitely working on it. All of the testing, both the type of testing and the type of sample collection, has to be validated, which means we have to prove that it can provide the result that we're expecting when they do it. So that work is underway. Saliva testing is probably the next step, but when you're collecting saliva, you need 3 milliliters of it, and so that's quite a bit, and it takes a while to collect that. And so when we're trying to test large numbers of people in short periods of time, the longer it takes to collect the sample, the less people we're able to test in the same amount of time. So there's a lot of things that have to be weighed, but the folks that are working on testing absolutely recognize the challenge with children. They're the ones having to collect the samples from the kids, so they're acutely aware of how difficult that is. So they're working hard on it, and as soon as it's available and logistically feasible, I'm sure it'll be available here in Tompkins County.
Okay, I've got one more question about testing, and then I've got some questions for Amy, who's sitting there so patiently. People wanted to know, why does Tompkins County include Cornell's surveillance testing in its testing data. And I'm sure there's a really good epidemiological reason for that. So
yeah, it's first, we want to make sure that the community knows the totality of what's going on from a testing perspective. You can go to Cornell's site and kind of see what they've done and compare that with ours and kind of get a feel for what's included and what our numbers outside of Cornell are. The challenge is that the folks being tested at Cornell are part of our community, right? So you could take their testing out, but then you also have to take them out, right? Otherwise, we'd have a low number of testing because we'd have, upwards of 25,000 people that are being tested by Cornell that wouldn't be in our numbers, but would be amongst us in our community. So there's no clean way to kind of make the separation between both. We are certainly managing and watching our numbers because obviously positivity rate is a key indicator that the governor and the state is using. So we're monitoring that independent of the Cornell sampling and testing procedure, but it's impossible to separate them, the two things, because we're one thing, we're one community, and so we're just doing one part of the community in a little different way. And really, we feel like from the health department's perspective, it's our responsibility to show what's happening in the totality of our community.
thank you. Okay, and then just one last question, Amy. I'm getting to you, I promise. This one just came up. How are we assessing, tracking, dealing with high-risk activities like contact sports that kids love to play, and a lot of our leagues are getting back into the swing of things, but isn't that a problem?
Yeah, so much of it is education. Right now, obviously, if we have a situation where someone is not following the guidance, our environmental health division is following up with them and making sure it's clear that they did something that was not in line with the guidance. It hasn't helped that it appears the state guidance isn't very clear around the state about how and whether those teams are supposed to travel. We are clear, they're not. And so we have been addressing it as such. But with everything, it's all in the details of what you're doing and how you're doing it. So we're just encouraging teams to read the guidance, know the guidance, understand that these high-risk sports can transmit the disease, and certainly any traveling associated with those teams would not be essential, and I would not recommend that they be doing it.
But is there any way to really follow up and make sure they're not doing it?
Well, we're certainly communicating with the leagues now. We've had some recent situations that's kind of brought all this to light. We did a press release about a sports event that led to a significant number of contacts. So we've been communicating with the different leagues, trying to get some clarity for them from the state. But we've been very clear with the folks that we are aware of that it is not in line with the guidance here in Tompkins County, and that if necessary, we'll take further action.
Thank you, Frank. Okay, Amy. Everybody knows the news has been pretty regularly reporting that the pandemic has had unequal impacts on different segments of society. What special community needs are you seeing in your role?
Sure. So we continue to meet with our community partners on an ongoing basis to see what's happening. One of the topic areas that we've been looking at is childcare. Prior to the pandemic, we were experiencing a serious worker shortage with only really enough care for about one out of 3 children. But when parents were sent home and began to work remotely, they of course took their kids with them. And the declining enrollments led to really a loss of more than half of our preschool and school age program spaces. So we have been working with childcare to restore some of these spaces, but this is impacting all of our childcare centers and our home-based care as well. 7 out of the 16, or 44% of our after-school programs actually are not open at this time. It's difficult for childcare centers because, as Frank said, with the school district shifting between virtual and in person, it's hard to kind of keep those spaces open and occupied. And it's also hard on our families and our parents. I know that many of the people that tune in can be parents, and this juggle is something that's a big challenge. At the same time, cost for childcare is rising. So with the schools losing those spaces, they're losing that income. So we're seeing that there are some gaps in our childcare budgets. So while we had kind of a childcare crisis pre-pandemic, I think it's continuing at that level, if not getting worse. So we're continuing to watch that and work with the Child Development Council and others to ensure that we're going to still have childcare. Another area that we continue to watch, so I'm going to jump through a couple of them, is housing. There is still COVID rental assistance programs, and they have resources available designated to provide rent relief for up to 3 months to eligible households. So that's someone who has experienced a loss in income related to the public health crisis. So we do have that rental assistance program. But again, we're continuing to watch this because we understand that the third area that I'll just briefly cover, that was our last town hall, I believe, or one of our previous town halls, is the economy and our workforce. And we are seeing challenges there as well. Again, the balance of the parents trying to manage both home and work. I know nationally we're starting to see that women are leaving the workforce at a higher rate than men. And that's just, one small piece of that. So we really have to make sure that we're kind of checking in on all of these different sectors and continuing to make that balance. So those are three big areas that we continue to look at. There are many more areas, and we continue to have those conversations and bring in our community partners.
Thank you. Well, that's all the questions that were submitted beforehand, and it also includes the questions that were posted in the chat. Does anybody else have something they want to take this opportunity to convey to the public?
Yeah. The only thing I would relay, Deborah, is that the community has done very well, and I think the prevalence of the disease is low in our community because of the community's response and the work that the community's done. Frank, the public health team, Amy at the EOC have done a great job working with community partners to best prepare, to provide information, to help give guidance. School districts, higher ed have all worked phenomenally well together, and community members have really stepped up and embraced the challenges that come with this. So I think, if anything, it's a compliment to all our community members here in the community. That's folks that live here, folks that work here, spend most of their waking hours here during the week. They're respectful of best practices, they're respectful of safety precautions and measures, and they take it seriously. And as a result, I think we've seen some real positive outcomes, and we continue to manage it the best we can with the resources we have. So the only thing I would have to say is that the community deserves a pat on the back and should thank themselves for doing some great work, because without them participating, without the cooperation of partners, we would not be in the position we're in today here in Tompkins County.
I would second that. And we got a last minute question for Frank. Why has the testing site seen delays recently?
Yeah, we've had a couple of days with some longer waits, and much of that can be attributed to folks going without an appointment. They try to use appointments to keep things moving. The challenge is they're also trying to prioritize people that are symptomatic. So if their appointment slots are all filled, they're still trying to squeeze those folks in. So the one thing I would just say to anyone that goes through our mall testing site, we've been spoiled. We've been spoiled for a very long time on how efficient they are and how quickly we get results. So if you go to the sampling site and you have to wait an hour to get through, I understand that's an inconvenience, but that is still a short period of time, because you will get your results the next day. You might go someplace else and get in quicker and only be there for 15 minutes, but it might be a few days before you get your results. So the short amount of time spent waiting will yield a quicker result for you in the long run. So please be patient with the folks up there. They're working their fingers to the bone, and they have been for months now. They're about to start doing it in the cold of winter. and they're still going to be out there for us and doing this work. So please be patient. Please try to make an appointment, particularly if you're not symptomatic and you're just wanting to know, make an appointment and stick to your appointment. So that way, if we have folks that are symptomatic, we can get them through.
Thank you. So thank you, Jason. Thank you, Amy. Thank you, Frank. Thank you, everyone in the community who's looking out for your neighbors and friends and coworkers. I know this is getting really tiresome. God knows I'm as tired as anybody, but keep up the good work and stay well. Thank you.